across the country, local governments are releasing thousands of inmates to stop the spread of the coronavirus within their jails.
We are looking to release the inmates that we think are appropriate to release.
Our population within their jail is a vulnerable population just by virtue of who they are and where they're located.
More than a dozen states, including California, Ohio, and New York, are removing prisoners to create space in crowded facilities. In New York City, Mayor Bill de Blasio has coordinated the release of hundreds of inmates. Governor Andrew Cuomo has also stepped in with plans to release more than 1,000 inmates in the state, 400 of them in New York City, according to the state's Department of Corrections and Community Supervision. The city is now the epicenter for the virus, with more than 45,000 cases. In its jails, the coronavirus is also spreading quickly.
The virus is spreading especially fast in Rikers Island because of the close proximity that the prisoners have to one another. They might be sharing a cell or in a bunk bed or in beds that are placed close to each other. And that's really what's driving the spread of the disease there, according to the people who work there.
The Department of Corrections said that as of Wednesday, 353 people had tested positive for the virus in the city's jails. That's grown from 3 cases just 2 weeks earlier. The virus has killed 2 department employees so far.
They've eliminated outside visits to the jail. They're placing the inmates who are sick with the virus into a contained area. And they're also trying to practice social distancing and the use of protective gear for staff, but the virus continues to spread there at an alarming rate.
The Board of Correction, the department's oversight agency, has sent multiple letters urging city officials to release even more inmates. It says officials should prioritize people over 50 years old, people with underlying health conditions, people detained for administrative reasons, and people serving so-called city sentences, or sentences of a year or less. Dr. Robert Cohen, who has worked for 40 years as a physician in jails, now sits on the board.
What will happen too quickly in the jails if we don't decrease the population rapidly enough is that people will be locked down and it will create a dangerous situation. So as many as possible should be released right now.
There are now less than 5,000 people currently in the city's jail system. While hundreds have already been released with plans for more, the board's letter identified more than 2,500 people it says should be considered for release.
In order to release the inmates, the mayor, the city's district attorneys, the state parole board, and the Office of Criminal Justice, which manages the jails, would all have to agree on the release of these prisoners.
In October, before the coronavirus, the city approved plans to both close Rikers and cut the number of people in the city's jails down to 3,300 by 2026. Cohen says the board is asking the city to speed up that plan.
And time is not on our side because over time, people staying in the jails are at great risk for getting infected.
Cohen was the director of medical and mental health services at Rikers Island when the AIDS epidemic began in 1981. He was on the board during the H1N1 flu epidemic, and he said he's never seen anything like this. Dr. Ross McDonald, the current chief physician of Rikers Island, also urged the city to release as many inmates as possible. On March 18th, he tweeted, "We cannot socially distance dozens of elderly men living in a dorm, sharing a bathroom." On this topic, de Blasio told reporters Tuesday that the jail system, which was built to hold 20,000 inmates, has space. Rikers Island has entire buildings not currently in use.
And we're using the space we have to create some distancing in general, to certainly be able to isolate anyone who needs to be isolated purposefully.
When someone is presenting symptoms in a New York jail right now, department staff inform correctional health services, who then screen that inmate. If clinically indicated, the inmate is then placed in special housing, so-called contagious disease units.
Eventually, staff are saying that facility is going to fill up. And then the plan is to probably open up additional buildings on the island for the housing of these inmates who may have the virus. But the issue is that these other buildings are decrepit and they may not have the facilities that are needed for people to live in them.
That's according to city officials I spoke to and experts on criminal justice in New York.
Removing people from jails would be a logistical challenge. Each inmate the city decides to release is considered individually. sometimes with input from multiple officials. And that takes time. But it's more than a logistical challenge for the city.
Trying to strike this balance between the humanitarian need to get everyone that we can get appropriately out of our jail system out, and be mindful that there are also real public safety concerns here.
Aside from releasing inmates and creating space in jails, the city has also taken efforts to stop inmates being sent to Rikers, as they may enter the jail with the coronavirus.
There's every indication that this is an issue that may become more severe in the coming weeks. And so it's really a multi-faceted approach to fixing this problem of a contagion in the city's largest jail.
Both the city's Department of Correction and Correctional Health Services said they were not able to accommodate interview requests at this time.